Welcome back to my channel, Pattern of Good Works. My name is Donna, and today we'll be in chapter number 10. The book that we'll be utilizing is The Specialty Practice of Rehabilitation Nursing, a Core Curriculum, the 8th edition. We'll be starting on page 167. So today we're under the header of skin assessment. And the book begins by talking about some of the things that the skin does for us. First and foremost, as the largest organ in our body, it provides protection from pathogen. It also offers some temperature regulation. For example, if someone becomes overheated or they are overly stressed or exert a really heavy exertion, the body will begin to activate the sweat glands and a person will perspire, and that will help to cool down the individual. We also see fluid management, and we also see that the skin allows some insulation. We know that if the skin is not intact, maybe due to a surgical incision, those benefits may not occur because there's a breach in the skin. So, what is our responsibility as registered nurses? It says that rehabilitation nurses need education and skills to assess, identify, document, and implement strategies for pressure injury treatment. But I want to remind you that there's a proverb that says that an ounce of prevention is worth a pound of cure. It's better to prevent, for example, a pressure injury than trying to fix it once there is an occurrence. So we will see in this week all the various ways that we can help to manage the skin of our patients. So the skin is comprised of three main layers. One, the outer layer is known as the epidermis. And there you will see the hair shaft, you will see a pore. On the second layer, which is called the dermis, you will find sweat glands, sebaceous glands, some arteries and veins. You also will see the base of that hair follicle. On the third level now, which is known as either the subcutaneous layer or the hypodermis, you will see, again, arteries, veins, but then you'll see some fat, some adipose tissue, and some nerve fibers will also arise from that layer. So if we took a cross section, the skin is not going to look the same. And it's also imperative, and that's what the book talks about, that it's imperative for registered nurses or nurses, specifically for prevention, to ensure that patients are assessed within 8 hours of admission and at least every 24 hours for clients at risk. Of course, you're going to follow your policy and your procedure for your organization, but it's imperative that as soon as you can assess the skin, do so, because it may change, specifically if the person is critically ill or is very fragile. Their skin may be impacted faster and be prone to pressure injury development. So I'm going to share some definitions with you from the book. So the book says that friction occurs when clients are pulled across surfaces. Dragging or pulling causes a rubbing action on the skin and results in epithelial tissue damage, which is not the same as shearing. Shearing damage occurs when the skin is stable and tissue below, such as fat or muscle, shifts. The movement of the deeper tissue reduces the blood supply, leading to ischemia, inflammation, and necrosis. Usually occurs in the bed or in a wheelchair. And I also want to just let you know that the U.S. Centers for Medicare and Medicaid Services, better known as CMS, will no longer reimburse organizations for stage 3 or stage 4 hospital acquired pressure injury. So it's imperative that staff use the devices that their organization has purchased to prevent dragging, pulling, and to ensure that those friction and shearing forces are not occurring when the patient is turned or moved in the bed. It's also stated here in the book that a risk assessment tool to determine a person's risk for developing a pressure injury are used to plan evidence-based interventions. Evidence-based interventions. And the main one that the book is highlighting at this time is something called the Braden scale. And the Braden scale is a valid and reliable tool to really assess pressure injury risk. It looks at the patient's sensory perception, exposure to moisture, their activity level, their mobility level, their nutritional intake, as well as exposure to shear and friction. And each item, again, is rated from 1 to 4, except friction and shear. And the Braden really looks at if the number is either less than or equal to 9, the person is at a severe risk. If it's 10 to 12, they are at high risk. If it's 13 to 14, they are at a moderate risk. And then if it's 15 to 18, there is a mild risk. What do we need to know? We need to know that it's everyone's business to ensure that the Braden scale is completed as well as documented, and interventions that are required are put in place to prevent a pressure injury. Lastly, there are 3 phases of wound healing, which you'll find on page 172. It says the inflammatory phase, which lasts 3 to 5 days and begins with injury or cell death. It's also important to note that macrophages or phages migrate to the wound during this period. The area is typically edematous, warm, red, and painful. In the proliferation phase, it begins approximately after the 4th day after injury and lasts 2 to 4 weeks. In this, you will see a framework of fibrin strands is formed, scar tissue develops from collagen, and there may be epithelial cells then grow over the granulation tissue. If you reach the maturation phase, can begin as early as 3 weeks after the injury and may last a year or longer. And it's going to be a continuous, scar tissue becomes thinner and more pale in color over time. The scar matures, becoming firm and inelastic when palpated. On page 173, it has on section or table 10.7 the staging system. And I just want to use the writing of the book to share the staging system. So stage 1 pressure injury, again, will always be non-blanchable erythema of intact skin. So you press it down, that redness stays. There's no blanching, there's no release. It's just red all the time. It's non-blanchable erythema. Stage 2, pressure injury, there's a partial thickness skin loss with exposed dermis. Stage 3 pressure injury is a full thickness skin loss. Stage 4 pressure injury is a full thickness skin and tissue loss. And it also highlights the unstageable pressure injury. So it's saying that obscured full thickness skin and tissue loss. And it can also include a stable eschar, which may be dry, adherent, intact without erythema or fluctance, or the heel or ischemic limb should not be softened or removed. And then lastly, a deep tissue pressure injury. DTPI is a persistent, non-blanchable, deep red, maroon, or purple discoloration. For this documentation of wound damage, and I know we talked a little bit about surgical incisions, I want to just remind you that the type of drainage, there's a description that is also found on page 174. Sanguinous is always going to be thin, bright red. Serosanguinous, thin, pale red to pink watery. Serous is always going to be thin, watery, and clear. Purulent may be thick or thin. It can range from tan to yellow. Foul purulent may be thick, yellow to green with an offensive odor. It has a smell. The amount of drainage can be none. It can be scant. It could be moderate. It could be large. And it could be odor. And odor says describe the presence of or absence of odor as strong, foul, fecal, musty, or pungent. The wound bed can be described as, or descriptions could be non-adherent, loosely adherent, firmly adherent, or a percentage of adherence. And then you would have the opportunity to literally describe the percentage of wound bed tissue adherence. Wound bed tissue can either be slough, eschar, granulation tissue, and epithelialization, which means appears as a deep pink and progresses to light purple from the edge. And then wound edges can be seen as, the definition is, describe the wound as having defined or undefined edges, attachment, rolled under, or border shape. And we find those on page 174. To review our skin. And we know that skin is the largest organ in the body, and it does so many things once intact to keep the body healthy. We also looked at the various stages of pressure injuries, various stages of wound healing, and also the different descriptive words that can be used to document our findings consistently so that any clinician could easily see what we found and is there a change. We want to thank you for coming along on this week's journey. We want to continue to encourage you to like, comment, and subscribe. We hope to see you the next time. Wishing you all the best. Take care. Bye-bye.